Today I'm going to talk about a subject that is very important to me. It's something that I've been thinking about filming for quite some time. You know, I have a lot of videos on YouTube, including this one here, and it's about hair restoration in young men. It is one of the most difficult subjects because there's no easy answer for this. I just had a gentleman ask me, 21 years of age, on a private message on YouTube whether he should have a hair transplant because he's been losing hair over the last 2 to 3 years. I don't think the concept is clear for the people that are young out there that hair restoration may not be the best option in someone in the early 20s. And the reason for that is, how is that going to age over a lifetime? It's a question of supply and demand. So I thought this was very, very important. Instead of answering questions almost every single week on YouTube, I want to present this here because there are a lot of places, a lot of clinics that will probably sell you a transplant. If you're 19, 20, they don't care. They're just going to sell it to you because you're in front of them. But I think it's very, very, very important you understand that hair restoration as a surgical procedure may not be the option for you. Why do I say may not and will not or should not? Because there's no absolutes in life. But if I at least explain to you the rationale, I think it'll become clear for you. Basically, think of it this way. You're going to continue to lose hair on top of your head over a lifetime. Usually, if you're in your early 20s, you're losing hair, you could be losing a considerable more hair over time. And then you also don't know what's a safe donor area. So the area where I harvest from the back and move to the front will dwindle. And so the areas of safety become less and less over time, and the area of danger where more and more more and more natural hair begins to become lost becomes more and more larger and larger. So if I create a very low hairline for you, a very aggressive transplant for you that may look good for you for about 3 to 4 years, it could become a problem in 10 to 15 years, and I may run out of hair of moving it forward to cover my tracks. So you get this transplanted hairline down here, and you've got this bald area behind it. It looks absurd. So I know it's toughest for you gentlemen that are in your early 20s, late teenage years, maybe even mid-20s, that are desperate to get a hairline that looks like your colleagues, like your peers. You really want that low hairline. If a 55-year-old gentleman comes to me and wants a conservative hairline, he's fine with it. But most times when I find young men, they not only want a transplant, they want an aggressive transplantation. I had a 27-year-old that wanted this really, really low hairline. I said no to him, and I said, well, I really can't do it. And he says, Dr. Lamb, listen, when I'm 40, I won't care what I look like anymore. I said, sir, I'm 42 and I care what I look like, and I want you to understand this is my ethical obligation to look forward for you and tell you, just like if you get a tattoo at 15 years of age, you may love it at 15, you may not love it at 40. So my goal is to be safe for you over the long run. Think of it using this analogy. It's like painting a canvas that's ever enlarging with ever dwindling paint on the back side of the head to move forward. So this canvas is getting bigger and bigger, and I'm running out of paint to paint it. And the younger you are, the harder it is for me to project forward where that's going to be. Although, if you're rapidly losing hair in your early 20s, I can almost assure you there's going to be significant loss down the road, and then I may not be able to cover those tracks. So what is my cutoff age? I don't have one, but I have operated in men in their mid-20s, and that's very, very discreet. Usually it happens when I've got to fix someone else's work, when someone was 21 and had the transplant, they shouldn't have had it, and they had an unnatural result, they had an aggressive hairline, and I've got to do everything to salvage this and save that hair for the next 20 years so I have enough to cover my tracks again. Basically, the older you are, the safer you are, with a lot of caveats. And the complexity here is, you know, if someone comes to me at 35, they may be unsafe. If someone comes to me at 35, they could be completely safe. What's the difference? An example of a 35-year-old, in my opinion, that may not be safe is someone that has significant loss, but worse than that, they're rapidly progressing and they've got very poor donor density. In other words, their hair, when I go back and look there, they have very little paint to paint the whole area. On the flip side of that, I see someone, let's say 45 years old, well, let's go back to 35. Let's say 35 years old, he's got limited loss, and he has robust, tremendous donor density back here. Very, very thick hairs that I know I can cover a ton of it, and also I know that in the future I'll be able to cover a ton of it. Even if there are a large degree of recession, I can still cover it, but that donor density in the back is so important, and your age is so important. I know this is not a clear-cut black and white story that I could say, don't get a transplant if you're 22, don't get a transplant. I'm not saying that, because I think every case is a specific case that is a judgment issue, but I get so many of these emails on YouTube that I don't have a video to refer them to. I've got to sit there and type out this long answer about why potentially in the early 20s you're not potentially a safe candidate for surgery. And I just, you know, about 85% of the time, maybe 95% of the time, I won't operate on you. Maybe I would say closer over 95%, I'm not going to operate on you, if not even that. But if you're late 20s and I'm seeing the loss is not significant, you got great donor density, I'm starting to feel more comfortable. In your early 30s, I'm feeling even more comfortable. By the late 30s, I'm feeling tremendously comfortable, and so on. And it all depends on donor density, how much loss there is, where the progression is, etc. Now, that's a negative news. How about some good news for some gentlemen in their early 20s? You're actually the best candidate for Rogaine and Propecia. I have no financial obligations or, affiliations with either company, but you're the best candidate to have this. And I had a gentleman that says, maybe I should wait 3 to 4 years to start. I said, no. Another gentleman sent me an email and says, my doctor told me only to use finasteride or Propecia, not Rogaine, because they work the same. No! These are wrong information you're getting. They work through different mechanisms. They both are important to help you out. Now, of course, the negative, if you stop using it over time, you'll lose what you gained over that time, but you're the best candidates for these medical management. So I'm trying to help you avoid potentially unethical surgeons that are going to operate on you because they just simply want your money, or they don't know any better. Sometimes it's out of ignorance. They're just saying, look, I can transplant a 19-year-old, I don't care, I'm just going to do a little hairline for them and be aggressive with it. And they don't get it. And so it's either miseducation, misinformation, or greed. So I want to save you from those problems, but I want you to get started on medicine if you want to be as socially integrated as possible with medicine. The medicine can truly help you. So I'm very passionate about this subject, a subject that I should have done a video on maybe 3 or 4 years or maybe 5 or 6 years ago, but I'm seeing a real deficit in that knowledge base, and I really want to help my young viewers out there on YouTube understand safety. And I just want to say safety, safety, safety. This is not a black and white video. It's really meant to give you guidelines so that as you find a surgeon or you find someone that may want to operate on you, that you stay safe and you understand that. Thank you.